Hey there, curious minds. Welcome back to the deep dive. Today, we're plunging into a really vital topic, women's health, and how it's supported or maybe not supported in workplaces across the UK. We've dug through quite a bit of research to find those crucial insights you need. And joining me is our expert guide, brilliant at connecting those dots for us.
It's great to be here, ready to explore this.
So let's just get right into it. There's this immediate concern. A recent report shows the UK has dropped to 41st out of 142 countries in a major women's health index, and that's a decline for the fourth year running. That paints a pretty stark picture, doesn't it? What factors are really driving this concerning trend?
You're right, that decline is significant. And it looks like a mix of things, really. We're
Yeah.
seeing, for instance, a noted drop in the quality of maternity care. That's a big one.
Yeah.
British women are also reporting much higher levels of emotional distress, sadness, stress, anger. And critically, there's less access to vital screenings, things like checks for high blood pressure, diabetes,
And
cancer.
screenings are so fundamental.
Exactly. And when you put these pieces together, it strongly suggests, well, a systemic underinvestment in women's health services overall, perhaps stemming from, a history of seeing women's health as somehow separate rather than core to public health.
That's a really interesting point about how it's been historically viewed. So, given that concerning national picture, how does this actually ripple into the workplace? What does it mean for women on the job day to day?
Well, it translates pretty directly into real consequences. We see increased absenteeism, for one, and unfortunately, career stagnation too. The data shows women are absent on average about 9 days each year purely due to health reasons.
9 days. Wow.
Yeah, and these issues often get worse because the support structures just aren't robust enough in many workplaces.
Okay, 9 days average. That really brings the impact home. So, digging into that workplace support specifically, where are the biggest gaps? What's missing?
This is where you see a major policy vacuum, frankly. Lots of workplaces just don't have comprehensive policies for, say, reproductive health. Think about this. Only about 26% of employers offer any support for fertility issues.
Only 26%.
Yes. And even fewer, just 18%, provide assistance for menstrual health challenges. These numbers are incredibly low. And this lack of understanding, this lack of practical support, it can genuinely force women out of the workforce.
It's quite shocking, especially for issues that affect so many women. Is anything being done then? Are there efforts underway to tackle these specific gaps?
Yes, absolutely. There are groups pushing for change. Fertility Matters at Work is a key one. They're actively campaigning for legal rights, specifically for individuals undergoing IVF to get necessary time off work.
That sounds crucial.
It really is. Their research found, quite strikingly, that 99% of employees they surveyed called fertility treatment a major life event, and 87% experienced anxiety or depression alongside it. So they're pushing hard for IVF to be properly recognized, maybe under the Equality Act, as a necessary medical procedure. That would be a huge step.
A really vital campaign. Okay, so moving towards solutions. What practical things can employers actually do to support women's health better? And what are some of the hurdles stopping them, perhaps?
Right, practical steps. There are definitely some key strategies. Flexible working is huge. It allows people to manage appointments, manage symptoms without adding extra stress. Then there's providing actual health support services. Things like virtual consultations for menopause, fertility support, help for new parents.
So access to specific services.
Exactly. And something often overlooked is training for line managers. It's not just about having a policy on paper. It's about creating a culture where people feel they can use the support, where managers understand hurdles. Often it's just a lack of awareness or seeing these as personal issues, not business ones.
That culture point is so important. It's one thing to have a policy, another to feel you can use it. Can you give an example of a company that's doing this well?
Sure. Centrica is often mentioned. They've made significant investments in preventive health services. That includes things like getting quick access to physiotherapy, strong mental health support, and they've seen results. Better absentee rates, better employee well-being overall. It shows that being proactive really does pay off.
It really does sound like it. So, wrapping this up, it's clear that supporting women's health at work isn't just, the right thing to do. It directly benefits the business productivity, keeping good people, building a more resilient workforce. For you listening, maybe take a moment to think about your own workplace. What are the policies like? Could you advocate for better support? Even small steps matter.
That's really the core message, isn't it? Investing in women's health isn't an isolated thing. It builds stronger workplaces, stronger societies. It's a strategic investment with real, long-term benefits for everyone involved.
A powerful thought to end on indeed. Thank you so much for sharing your insights today. And thank you all for joining our deep dive. Until next time, keep learning and stay curious.